Hello! Today I'm going to show you how to identify the structures of the heart. This here is a human heart model, and right now we are looking at it from the anterior, so from the front side. The first thing that we notice is this protruding part here, and this here is the apex of the heart. So here we have the apex. We see that the heart is divided in two parts. And we can recognize that the heart is divided into two parts by looking at this groove here. So this groove is the intraventricular groove, and this is the intraventricular groove. And we also see the intraventricular artery and the intraventricular vein up here. Now, this part here, is it the left or is it the right ventricle? What do you think? Now, since we know that this here is the anterior part of the heart, so when you look at the anatomical position, we notice that this here has to be the left and this here has to be the right part of the heart. So what we see here, this here is the right ventricle. Then on the left side is the left ventricle. And up here on the right side, this here is the right auricle. And on the left side, we see the left auricle. Below the right auricle is the right atrium, and below the left auricle is the left atrium. And I open this flap here. You see this here is the right atrium. This vessel that we see up here is the superior vena cava. And here you see the aortic arch. From the aortic arch, this here is the brachiocephalic trunk. Brachio means arm, cephalus is the head. So this is an artery that will supply oxygenated blood towards the arm and towards the head. This here is the left common carotid artery. It's the left common carotid artery. And this here is the left subclavian artery. While you're looking at the vessels, we see some vessels up here and here. So this here is the circumflex artery. And here we see the right coronary artery. Down here, this part is part of the inferior vena cava. When we look at the heart from the posterior view, we see here the left atrium. This here is the left auricle. And the blood that flows into the left atrium comes from the lungs. These here are the left pulmonary veins, and this here are the right pulmonary veins. Now, normally veins carry deoxygenated blood, but we define veins as the vessels that transport blood towards the heart. So the blood flow here comes from the lungs towards the heart, and this is highly oxygenated blood. This vessel here is the pulmonary artery. So here we have the left pulmonary artery, and this is the right pulmonary artery. It transports the blood from the heart towards the lungs. So the blood flow is in this direction or in this direction. Here again we see the aortic arch, and this here is the superior vena cava. Let's take a look on how the blood is transported through the heart. We start with the blood flow that comes from the body. So here from the superior vena cava and the inferior vena cava. Now I open this flap here. This is the auricle of the right atrium. And the blood flow, which is deoxygenated blood, comes from down here and from up here and goes into the right atrium. When the right atrium is filled, the the blood will flow into the right ventricle. So this here is the formula. This is how the blood flows into the right ventricle. I'm opening the the ventricle. So you see that the blood flows through this valve here. Do you know what the name of this valve is? Now, this valve, we know it's on the right part of the heart. So part of the name is right. And then this here is the atrium, and this here is the right ventricle. So this is the right atrioventricular valve, or sometimes also called the tricuspid valve, because we see three flaps here. So this is the tricuspid valve, or the right atrioventricular valve. Once the blood has entered the heart, it will eventually flow out and go towards the lungs. But let's look at the structures of the right ventricle before we continue with the blood flow. So this muscle that you see here, this is called the papillary muscle, and it connects the chordae tendineae with the heart muscle. Down here, you see some kind of striated types of tissue, so those lines here, and they are called the trabecular carne. Trabecular is the Latin word for beam or rod, and carne is the Latin word for meat. You find them down here, the trabecular carne. This part here is the septum of the heart. So the intraventricular, between the two ventricles, the intraventricular septum. You know that the blood comes from the heart. Now it has to go to the lungs to become oxygenated again. So this valve here is called the pulmonary valve. So here we have the pulmonary valve. When the right ventricle constricts, it closes this flap that gives us this first this lump sound, and then the blood gets pressed out towards the lungs. So the blood flow is in this direction up here, and then it goes towards the left and the right lung. Once the blood is oxygenated again, it will flow back to the heart, and it will enter the heart through the left atrium. So here we have the left atrium, and this here are the left pulmonary veins, and these here are the right pulmonary veins. Those veins carry oxygenated blood. The blood fills up the left atrium, so the blood will flow from the left atrium towards the bicuspid or the mitral valve up here. So I'm putting blood flow down here. When we open the model again, you see that the blood is flowing from the left atrium into the left ventricle. Here again we see the left auricle. So this here is the left auricle. And this here is the left ventricle. Inside the left ventricle, you see again the bicuspid valve. It's also called the mitral valve. So the bicuspid valve is connected to the muscle of the heart until the papillary muscle. So this here is the papillary muscle again. You have seen it here on the right side too, but this is the papillary muscle on the left side. What we notice is when you look at the wall here of the heart, that the wall of the right part of the heart is a little bit thinner than the wall of the left part of the heart. And this is because the blood here through the right ventricle, it's only pumped towards the lungs, which is kind of a short distance. Now, the blood that is pumped away from the left ventricle has to supply the whole body, so it needs a much more pushing strength. So this muscle is way bigger than the muscle here on the right part of the heart. Now we have seen the papillary muscle, and behind the papillary muscle again, we see those trabecular carne again. So those trabecular carni, the meaty rods or the meaty beams of the heart. And then when the blood flows out of the heart, it has to go through another valve. So the blood flow goes into the left ventricle. And now when the left ventricle contracts, it closes this mitral valve and it will open the aortic valve. And the aortic valve will allow the blood to flow into the aortic arch here. From the aortic arch, the blood gets transported towards the whole body. We have already seen the arteries that branch off the aortic arch. The first branch here is again the brachiocephalic trunk. The second one is the common carotid artery. So this is the left common carotid artery. Third branch is the left subclavian artery.